Okay, Marika's spoken long enough. I'm just going to do 2 minutes. Yeah, I'm the lucky person that got the last session on the last day. So I'm sure all of you guys are information overload. So I'm going to try and keep it brief. But yeah, so for my master's, I looked at the rehabilitation workforce of 3 rural provinces. And so this was a study done under my supervisor, Prof. Cornetlo, that's there. And the larger study was looking at the rehabilitation workforce capacity, just the rehabilitation capacity in South Africa. So that's kind of where it's at. And so I think the main reason behind the study, okay, well, sorry, I was supposed to swap the 2 slides, but it's just to look, I think we all know that there's a problem with the rehabilitation workforce, but do we know to what extent? And so we looked at those descriptors to try and find out what exactly the capacity is. And I think what I wanted to know from you guys before we start, to make it a little bit more interactive, is what do we know about the rehabilitation workforce before we actually had the data? Why? Ash? Okay, anything else? Okay, so just in general, we know it's insufficient. It's not enough. We know that the need for rehab is increasing, and we just don't have enough rehab to fit that. We know we have less therapists in rural areas. We know that primary healthcare is poorly resourced. We know there's an inequitable distribution between the profession types, but we don't have the data for that. So yeah, but that's not part of a study. You've spoken about that already enough. Okay, so I'm not going to go too much into the methodology. Hopefully the paper will come out soon, so you guys can go and read that. But it was a cross-sectional web-based survey. And we looked at three rural provinces in South Africa, and we used REDCap because it was easy enough. It didn't use up a lot of data. I think I looked and it was less than 1 megabyte of data, and you didn't really need a lot of time to fill it in. So we looked at audiologists, occupational therapists, speech therapists, speech and audios, only in the public sector, and then those 3 rural provinces. Why only 3 rural provinces? Because of lockdown. But anyway, we got there. So the process that we took was recruitment that we did through the existing networks that we had. Then we did this actual survey. Then we did a data validation together with the feedback. So how we did that was with the web-based results that we got, we asked the provinces to check and see, is this actually how many therapists are at each facility to compare, and that was kind of our data validation. That was it. Yeah, so we used REDCap, and this is basically what it looked like. So it was, you could use it on your phone. And so this was the first consent part. And then this was the part, see, I forgot to black out all the clinics, so I'm going to go through it quickly. But yeah, just various information was all drop-down lists to make it easy enough for everyone. So the first thing we looked at was profession type. And like we said, there's a very unequal distribution. So the web-based survey, we got 369 responses. Oh, sorry, my fingers are going trigger happy. And with the data validation, we found that there was actually 1,166 therapists in those 3 provinces. But I think what was quite nice is that the percentages, the proportions are quite similar what we found in the web-based survey as compared to the facility-based one that we did. And I think before we kind of, or I assumed that there were more physios than OTs in the public sector, but there are a little bit more OTs than physios. And I mean, we all know that speech, we don't have enough speech therapists. We all know that that's quite an unequal distribution. And then looking per province, again, where based versus telephonic, you can see it's, well, I mean, the province 2 for the first web-based survey, it just means that there was a better response from speech and audios. Okay, so then next we looked at age of therapists, because I think we all know that our therapists are young and inexperienced. So to kind of just sum it up, in province 1, the mean age was 28, 2 was 34, 35, 3 was 30. And then if you look per profession, yeah, that's quite a young workforce. Good. And then I think when you take that into account and go and look at the years at current facility, you can see that with a young workforce, I mean, in province 2, the most years, that mean years was 8 years. And looking at 3 years in the East, sorry, the first province, keep getting, and then per profession, you can also see that that's it. Cool. And then we also just looked at qualifications. And if you have a look, in those 3 provinces, we had 1 PhD in physiotherapy. Occupational therapy had the most master's qualifications with 15, and then the other are quite equally distributed. The certificates and diplomas were mostly the PTTs and OTTs, and then next we looked at salary level, and I think we all knew that we're relying on ComServes quite a lot, but not to this extent. So in these 3 provinces, about 30% of the workforce are ComServes, which is quite concerning. There we go, that's the word. Just in terms of what do we do if we don't, 1 year you don't get ComServes. But there's quite a big workforce with production level, which I think is positive. And in the managerial posts and the assistants, it's very, very low. So yeah. And then if you look per profession, again, but basically you can see in speech, half the workforce is in speech are ComServes, which I think shows very much if you look at the clinical practices or the access to speech therapy in the rural areas. And I think speech and audio kind of the same. So yeah, and then physio and OT, only quarter, yeah. And then level of care. So we all know that primary healthcare is low, but 3% is very low. So I think that's also something quite significant and concerning. Yeah, seeing as that's where most of our population access care, healthcare. And then if you look at it per level of care, just the distribution of the different professions. So again, physio and OT being the biggest portion of those. And then rural versus urban. I think these stats were quite enlightening, but yeah, if you see in province 1, there's a huge distribution, but just to keep in mind that these were 3 of the most rural provinces in South Africa. So if you look at province 2, I think it's normal that would be a little bit higher, but still it's very concerning because most of our populations are there. And in province 3, less again. Then next we looked at distribution per uninsured population, and if you thought the picture was looking bad, I'm sorry, it gets worse. So if you look at this, so in province 1, well, basically just in general, all of it is less than 1.5 therapists per 10,000 population, uninsured population. And then if you look at the different professions again, I mean, you can just see less than 0.1 for speech and audio, and yeah, so that's quite concerning. And then we had a look at the districts, and so yeah, so kind of similar picture, just again, speech and audio being quite low, and physio and OT varying quite a lot. So here's just a table showing the population and the percentage, so the total of therapists and the percentage that is. And in most of them, you can see that the larger populations obviously have more therapists. And then lastly, sorry, I'm going to make it even more disappointing, but if we compare this to other countries, I think, is the mouse there? Oh, there we go. According to some of the studies, we really compare with, oh, this is physio, we compare with low income countries like Pakistan and Bangladesh, and we're a upper middle income country. Occupational therapy, same thing, 0.8. So, and yeah, Pakistan is 0.01, but it's still less than 1 therapist per 10,000. Audio, overall, I think the problem with OT and speech also is just that there is not a lot of data done available on workforce for those professions, but yeah, still less than 1. And then this was mostly a study on physios and OTs in high income countries, but then we added the lower income countries just to give a bigger picture. And again, you can see we're pretty matched with Bangladesh, Pakistan, and then the lower high income countries like Trinidad and Tobago. So yeah, it doesn't look too promising, but I think, yeah, at least now we know that our workforce is comparable to lower income countries. We have a young, inexperienced workforce. 30% of it is ComServe. And the other thing, just in terms of the having workforce, the high turnover, is that you kind of lose institutional memory, and yeah, things can't really carry on. And 3% at primary healthcare, yeah, I don't need to say anything about that. So the thoughts are, so what now? That's at a facility. Yeah. So not in these 3 provinces. In these 3 provinces, so like we had, unfortunately for some of the urban provinces, we only got per cell data. And those are the urban ones are the ones that are lucky and have a therapist per district. But in these 3 provinces, it was just at a facility, and very often it would be like 1 at a primary healthcare facility or 2. And yeah, okay. It was so what now? References and funding.
Yeah, thank you very much. It looks like she doesn't want questions. First, I'll go to the lady that I've.
Prof. Lo, did you also want to say anything?
Yes.
Before we do questions. Okay.
So I'm from the Cape Winelands district in the Western Cape. And I just wanted to know, did you look at the composition of the number of therapists per institution?
Yes, we did.
That wasn't on the slide.
Yeah,
right?
because of privacy, we weren't allowed to go into that much detail. So we did have a look at it to kind of confirm numbers. So when we did data validation, we got therapists per facility. But yeah, we had a MOU with the government, and so I mean, yeah, confidentiality. So we can't go present in that much detail.
Yeah, I think it would have been, even though you did it, you could have done it anonymously, but it would have been nice to see how many, you know, how your therapists are distributed, because I think in the Western Cape, it's totally different from how you guys work. En ek is bietjie spyt ek het die jou eerste praatjie gemis, want ek sal nog as baie graag wou gesien het, but to see yeah, how you distribute the how therapists are allocated, you know, where they work and how they work, because that really makes a difference in rehab. And I'm just listening to all of this data, and maybe it gives one an opportunity now to kind of redesign the services that we are rendering, and looking at how we collaborate with, if you're looking at primary healthcare, you know, do you associate primary healthcare with the district hospital? Do you take that into account? Or is primary healthcare seen as an independent entity, or a district hospital independent, regional hospital independent? Or, because I mean, in our setting, we would have one physio that would service a district hospital in an outpatients, and then they would serve 7 primary healthcare clinics, you know. So I was just, it's very interesting to see how therapists are allocated and how services are distributed.
Yeah, so that wasn't, so that, I think most of that falls into the larger rehabilitation capacity project. In terms of distribution per facility, or that, I think the level of care kind of gives a picture where secondary care was both regional and district. And then there was the tertiary and the primary care. So what we did with this was we really actually wanted to see how many therapists were allocated to a facility, because I think that's something big that's missing. We did take in outreach to clinics. So in the, it was mostly just in the capacity project, and in my thesis, just looking at how many actually do outreach. But I think the problem is, again, this is 3 rural districts, so it's very different to like Western Cape and Gauteng, where you, and that's what a lot of the hospitals did say, is they do outreach to the clinics, but remember we did this during COVID, so a lot of those outreach programs were stopped. And I mean, transport is really a big problem. So and we did look at the coverage of the primary health, like of outreach, but yeah. Yes.
Oh, sorry. Are you asking about whether we looked at the outreach, for example, if the therapist is based at the facility, do they also serve 6 or 7 or sometimes it was 10 clinics? Yeah, we did. Yeah, in these 3 provinces we did. Yeah. So we do have data on the outreach, and then we also have for these 3 data per district. So you could actually then look at how many people should be served, or depend on the public healthcare sector, and then how many of each of the therapists serve those districts in either in the capacity of them being based there or outreach. But the data that you showed now is that this 3% is just in these 3 rural provinces. Those are that's just a percentage of facilities where there is at least 1 therapist. So I think it's also something that we need to think about, is the you know, if the need is so significant at a primary sector or level, so to say, you know, is outreach enough in terms of the intensity of the service and so on. Yeah, because it was actually a surprise to see that our primary care rehab is so poorly developed in South Africa that, you know, like for example, in these 3 provinces, it was primarily just dependent on outreach. In the Western Cape, I think it was 7% of therapists being placed, and that was mostly in the urban areas at the primary care facility. So that's continued services or continuous services on a daily basis. But and I think that is the biggest difference in the high and low income settings. In the high income settings, in order to improve access, they've strengthened primary care, whereas that is still lacking in many of the low and middle income settings. And if you look at other contextual issues like early discharge and so on, you know, that is our huge opportunity. I think if we can latch onto the NHI and really, you know, make sure that we walk the path or journey and make sure that we are integrated, for example, in the primary care, that will significantly reposition ourselves at a better position or strengthened position at primary care.
Yeah, that was our last comment. We have run out of time.
Thank
I'm
goodness.
so sorry. Yes. So this was very fascinating to see your passion and how every one of you from various provinces take a small section or just a small part and go and look for answers and bring it here all together just to improve service, which will then enhance the quality of care that we give to our patients. So I've learned a lot here being a nurse, and really all the presenters were physiotherapists, and I was exposed to physiotherapists at undergraduate level. Then I went to theater, but I just knew that they assaulted the patients many times, hitting them on the back. So, but thank you much, very guys, and enjoy your day further. Yeah, thank you to the online attendees as well.